I didn't like when they...
The northern Italian city of Bergamo. Crematorium so...
4 hours. On Monday, China reported 78 new cases of...
Untuk memaklumkan status terkini wabak COVID-19 di negara kita.
According to WHO, the China country office was informed of cases of pneumonia detected in Wuhan on 31 December 2019. On 30 January, WHO declared the coronavirus outbreak as a global emergency.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do.
In Malaysia, cases started to drastically increase from 29 infections on 1st of March to 3-digit figures within a week. Following the spike in cases linked to the public gathering in Sri Petaling, and as cases rose to more than 200, the government decided to announce tougher measures. The federal government imposed a Movement Control Order (MCO) to stem the spread of the disease. The order is based on the Prevention and Control of Infectious Disease Act 1988 and the Police Act 1967.
The movement restrictions announced by our Prime Minister may seem drastic all at once, but they're actually very reasonable social distancing measures. However, we must be careful about unintended consequences.
Hey guys, so the government have announced a movement control order to deal with the rise of COVID-19 cases in the country. Here's what a health system and policy expert has to say about the measures.
Many of these measures have been taken by other countries. Usually they've been phased in, perhaps one measure a week for the last several weeks to months. What's unusual is that Malaysia's government has decided to take all 6 measures at the same time. And I think this is causing the population a lot of panic, a lot of uncertainty. We're fearful about why these 6 measures are taken at the same time. What we really have to do is to watch out for the unintended consequences of adopting them.
After all that, will there be any unintended consequences happen to the country?
First category is the unintended consequences to the health system. This is my speciality and my passion, and very important for Malaysia. If you are closing schools or extending school holidays or whatever the situation is, a lot more children, in fact 5 to 6 million Malaysian children, will stay at home. They will require childcare. Now nurses will then be faced with the dilemma: do I stay at home and care for my children, or do I leave to the hospital and care for my patients? And that is a very difficult dilemma to face. The government must help them make these decisions so that they can balance their family obligations and their public responsibility to society. That's one example of a very large unintended consequence in the health system. The second example, or rather the second category, Joshua, is our unintended consequences in the economy. The restriction of travel, for example, in and outside of Malaysia, and the restriction of movements will definitely result in some impact to the economy. So our growth will be reduced, our profits and revenues will drop, global trade will drop as a result, Malaysia's competitive advantage vis-a-vis or in relation to other Southeast Asian countries will be affected. All this needs to be considered as an unintended consequence. Therefore, the stimulus package that was announced previously is a very welcome addition to soften the blow to the economy. The third category of unintended consequences will be to society, including to the workers especially. There could be an unintended consequence of mass hysteria, panic buying, supplies running out, and profiteering. Therefore, the Consumer Affairs and the Domestic Trade Ministry needs to take a very active stance to prevent any of this from happening, that people are not actively profiteering, that people are not abusing the privileges of the system. To the workers themselves, especially those who are working in the gig economy, at the moment, the law isn't very clear about what rights do workers have during times of outbreaks. If you're going on quarantine, for example, can we take the days of quarantine away from your sick leave or annual leave, or is there a special third category of quarantine leave? You don't have many employment rights, and as a result, the government of Malaysia must take care of the welfare of workers who are unemployed, underemployed, or employed in the gig economy. So those are examples in 3 broad categories of unintended consequences.
So how can the government do better in the future relating to COVID-19?
The first one is to trust the health professionals. We need more scientists to come into the picture, and the politicians need to trust the scientists during periods of national crisis. Bring them into the cabinet and let them advise you as one additional data point as the politicians are considering the fate of the country. The second one that the government of Malaysia can do, Joshua, is to introduce predictability into their decision making. Now, these decisions are great decisions and I support them. However, we have to give enough notice, psychological, emotional, logistical notice for the people of Malaysia to prepare for it. And when they get used to the rhythm of government, there's more predictability. And when there's more predictability, there's more confidence.
What about us as citizens? What can we do?
There are equally many things that we as citizens can do, and one of them is to unite against this common threat, and that threat is a virus. It is not Malays, Chinese, Indians, or different religions, or different states, or different countries. This is an opportunity for Malaysia to unite, to think about other people that we can help. Civil societies will hopefully spring up, and I imagine that the youth of Malaysia will think about taking care of the old, the rich of Malaysia will think of taking care of the poor, the healthy of Malaysia will think of taking care of the sick. And this is a way for us to unite our country.
Untuk menyekat penularan wabak ini dengan cara menghadkan pergerakan orang ramai.
Hey guys, how's everyone doing? Currently, I'm staying at my home in Sabah. As you know, the situation around the world has changed because of this pandemic. Now, we are currently in MCO, and here are the few changes that we must get used to. Number 1. Stay home. Everyone is required to stay at home. All non-essential businesses and services such as museums, retail outlets, gyms and schools are closed. Only the important ones will remain open, like public safety, healthcare, utilities, banks, transportation and restaurants. Number 2. Food. The restaurants that are open are only available for pickups and deliveries. There are a few food delivery apps out there, and most of us use Foodpanda and GrabFood. So, don't worry, you can still enjoy your favorite foods at home. Next is groceries. Thankfully, we are still able to go out to get our supplies and groceries. However, we must follow the SOP, which is only one person from each household can go out at a time. Supermarkets, wet markets, and convenience stores are still open, but in revised operating hour. So, you will find places like Family Mart, 7-Eleven, and KK Mart are still open. However, no longer 24 hours. You also find that wet markets and farmers markets are closed for now to avoid mass gathering. They are also implementing social distancing, which my friend will explain.
Social distancing is the practice of reducing close contact within yourself and others to help slow the spread of infectious diseases and germs. This is because the spread will happen when an infected person coughs, sneezes, or talks, and the droplets from their mouth or nose are launched into the air and land in the mouths or noses of people nearby. This infographic shows how this social distancing can reduce the spread of the virus. With no changes to social behavior, one infected person will on average pass the virus to 2.5 people within 5 days. After 30 days, the figure would rise to a devastating 406 new infections. The number can be significantly reduced by engaging in less social contact as shown by this calculation. Therefore, Social distancing is essential in this situation to greatly reduce the burden on health services and if followed by everybody, allowing a country to flatten the curve of new infections. So, how to practice social distancing? To practice social distancing, first, we must stay at least 2 meters from other people to avoid being exposed to this virus due to close contact. Social distancing must be strictly practiced when you need to shop for food or medicine at the grocery store or pharmacy. Next, avoid large and small gatherings in private places and public spaces, because you can be infected by breathing in the virus if you are within close proximity of someone who has COVID-19. Stay at home and stay out of crowded places is one of the ways to practice social distancing. People are encouraged to use mail order for medications if possible and consider a grocery or food delivery service when there's a need. The company can practice social distancing by launch work from home plan to remain work effectiveness, and the school can also launch digital learning to support students' study.
Number 4. Mask. Right now, there is no requirement wearing mask in the public unless you are sick, having any symptoms or taking care COVID-19 patients. This is because there has been a shortage of masks in the country, and the priority will go to the people in the front line like doctors, healthcare workers, and patients. Number 5. Healthcare. If you are concerned about showing signs or if you think you're exposed with the virus, these sources are provided by the Ministry of Health. There's a quite few features on it, like they have hotline numbers, live chat with doctors, and a list of hospitals to go to. So don't panic, as this website will assist you. And lastly, travel. Now all the flights are cancelled, foreigners cannot go home, and also to the Malaysians who are still out of the country cannot go home due to the high chance of getting infected with this virus. Unfortunately, this happened. Due to the increase of COVID-19 cases, the government have decided to extend the MCO.
The movement control order has a compliance rate of about 95%, but with the number of COVID-19 cases continuing to rise, the Malaysian government is not taking any chances. Prime Minister Muhyiddin Yassin has announced an extension of the order aimed at keeping people at home. During a special address broadcasted on national television this afternoon, the Prime Minister said the order will go on for an extra 2 weeks until April 14th.
Sehubungan itu, kerajaan telah memutuskan tempoh perintah kawalan pergerakan akan dilanjutkan sehingga 14 April 2020. Saya memaklumkan pelanjutan tempoh ini lebih awal supaya saudara-saudari lebih bersedia. Anda yang berada di kampung tak perlu bergegas balik ke Kuala Lumpur hujung minggu ini. Duduklah dulu di kampung dan jangan ke mana-mana. Anak-anak yang sepatutnya balik ke asrama tak perlu balik ke asrama lagi. Tunggu dulu. Pejabat-pejabat yang masih ditutup tak perlu dibuka sehingga sekarang. Jika ada perkara penting yang nak diuruskan dalam tempoh 2-3 minggu yang akan datang, rancanglah dari sekarang bagaimana nak menguruskannya. Please stay calm and don't panic. Now, even though we have extended the movement control order, you don't have to unnecessarily stock up on food because the supply is sufficient, and I assure you that food is enough for everybody.
Muhyiddin urged the people to stay at home and not make any unnecessary travel.
You follow my instruction. You know that this is good for you, your family, and the people around you. Your awareness and sincerity in abiding but the rules imposed by the government during this movement control period is highly commendable. Thank you.
There are 6 instructions contained in MCO. A comprehensive prohibition of mass movement and gatherings including religious, sports, social and cultural activities. All restriction on all Malaysians travelling abroad. Restriction on entry of all foreign tourists and visitors into the country. Closing of all kindergartens, government and private schools and other primary, secondary and pre-university institutions. Closing of all public and private institutions of higher learning, IPT, and skills training institutions nationwide. Closing of all government and private premises except those involved in essential service.
The coronavirus pandemic had initiated the Movement Control Order, or we known as MCO, and this initiative had impacted a lot of sectors and industries. From the point of education, home-based learning initiative was implemented throughout the duration of MCO as schools nationwide were closed during the period. Assessments and examinations were cancelled. Some institutes were converted into temporary surveillance and quarantine centers. Students' performance evaluations were replaced by continuous assessment and scores. From the point of economy, closure of businesses and services along with the MCO will have outsized the impacts on private consumption and business investment. Individuals and businesses affected by the temporary closures will be at high risk of facing immediate cash flow constraints as their earnings dwindle. Critically, this will impact smaller businesses and vulnerable groups such as lower income individuals and workers. Factory shutdown and massive layoffs. Many people lost their jobs. In response, an economic stimulus package was unveiled. Prihatin's main job is to protect the welfare of the people, support businesses including small and medium enterprises, and strengthen the economy. From the point of essential supplies, supermarkets across the country began to see a surge in panic buying. The supply of surgical masks and hand sanitizers everywhere was out, causing prices to skyrocket. How exactly does a lockdown work? R below 1. The purpose is to reduce reproduction. In other words, to reduce the number of people each confirmed case infects. Without any lockdown or social distancing measures, we can expect peak mortality in approximately 3 months. The logic is simple. If the MCO is not implemented, COVID-19 would spread uncontrollably as those infected would be transmitted through the virus without normal social interactions. Starting 23 January, the Chinese government locked down Hubei province, including Wuhan, the city where the outbreak started. Following the lockdown, the cases began to slow. On 19 March, China's National Health Commission reported no new confirmed infections in Hubei.
Hello everyone, so today is still the movement control order period in Malaysia. So today I'm going to show you what activities I will do during this period. So today I'm planning to calling my friends in Indonesia because I already missed them, and I will conduct the meeting through Zoom. So let's get started guys. This is Nabila, this is Dira, and this is Keiko, and this is Naya. All of them are from Bandung. Please say hi guys.
Hi.
How are you?
Good. Hi. How are you?
Good.
When will you go back, Raffle?
I think I will go back after I finish my renewal visa. Talk with them right now, and later I will give you an update about what we're talking about. I have just finished the call with my friends in Malaysia right now. We talk about a lot of things, like we give the current update and situation in Indonesia and in Malaysia. We compare them and we talk about how government handle this situation. So thank you guys for watching. Stay safe. Bye.
Okay, Assalamualaikum. My name is Dinesh, and during MCO, I become a bookworm. Okay, during MCO, we cannot go outside, we cannot play outside, or rather we cannot go hang out with our friend. So during MCO, I decided to spend my time read a book, because for me, reading a book can increase my knowledge about work, about education, and about general knowledge. So second, reading a book also can increase my vocabulary in English, because when reading English book, I can know a lot of new vocabulary, and also I like to read English book. Okay, third, there are many types of book that we can read, such as we can read newspaper, we can read books novel, we can read journal, or rather we can read comics book. Okay, so for the lastly, that's what I did, and I am very enjoyed to read a book, and I also want to invite you guys to read book also. So stay home and stay safe.
Hello everyone. So many have asked, many have wondered, what should I do during the lockdown? Actually, there is a lot of activities you can do, and one of my favorite activities that I like to do during the lockdown is to work out, to work my body down. So I would like to share my workout routine to you, and I hope you guys enjoy. Now the first thing that I would like to do, my favorite workout, is push-ups. Now push-up help your biceps, your chest muscles, and your abs. So I recommend you to do it 10 to 15 sets, and it will work out. So the second workout that I recommend is crunches. It helps you with your abs if you want to get your six packs. Believe me, your girlfriend will love it. So that's two of my basic workouts that I recommend to you. The question is whether you are committed to do it or not. If you are, you will get yourself a body like mine. So that is all from me. I hope you guys enjoy my video, and stay safe everyone.